Hello everyone. How are you today, my friends? Still your dietitian and public health officer Justina. I have a good topic for you today, which is what? Diabetes mellitus. Why this topic? This topic is a diet related disease topic, and also it is a disease of a public health concern because it does not respect your age, it does not respect your finance, it does not respect your sex, it does not respect so many things. It comes at any point in time. So this is why I am bringing it to you today. So it is affecting so many people and the rate of mortality is increasing. So I want us to be very serious with this. Learn, listen so that you understand, and also put in practice whatever that will be taught. And you know when you have an informed knowledge, it helps you to act positively to whatever that is required. So at this stage, let's look at what diabetes is all about. So I'll just give you a definition according to WHO. According to WHO, it is stated that diabetes mellitus is a metabolic disorder of chronic hyperglycemia characterized by disturbance of carbohydrate, protein, fat metabolism, resulting from absolute and relative insulin deficiency with dysfunction in organ systems. So this is just a definition. Don't worry, I will explain. And I'm explaining this in three aspects that are very, very important. One, I want you to know what a hyperglycemia is all about. It's just high sugar in the blood. So again, when it says it is by the disturbance of carbohydrate, protein, and fat, these three nutrients, they are called nutrients, and we get them from food. These three nutrients, I told you that they are responsible for energy production in the body, and they have other functions they do. I explained it. I gave a good elaboration of them in my topic. If you go to my YouTube channel, just search for Justina Nkechi. There you will see macronutrients and its importance, and also fiber that you will see there. So you follow up and know the functions of these nutrients. They are very important, but in this aspect, it disturbs when diabetes sets in. These three nutrients, understand, are disturbed in the system. So you have to be conscious, especially the carbohydrate. So you have to be conscious of what you eat that gives you energy and how you take them. So again, I want you to know the aspect that said resulting from absolute or relative insulin deficiency. So what are we trying to talk about? That insulin is important in this aspect. So insulin is produced by the beta cells of the pancreas, and its works is what we just in a common meaning is just we call it driver that drive sugars from the blood to the cells where they are required for energy and others. That is the work of insulin. So insulin is a hormone that the body produces whenever you eat to take care of the sugar coming from the food. So insulin here is a problem. Are you seeing it? Then again, also the dysfunction in organ systems. Understand? So when this sets in, it affects so many organs, especially the nerve, the eye, the kidney, the heart. So therefore, this is a disease of public health concern because it needs to be taken care of. So many people are dying because of this. So what are the classification? We have different types of it. The type 1 diabetes, that one mostly they say is childhood and all that. So because of it is an autoimmune disease, resulting that the body starts attacking and destroying the insulin producing beta cells. So this is just what causes this insulin deficiency. In this type of diabetes, there is an insulin deficiency, total insulin deficiency. because the body is already attacking the beta cells of the pancreas that produces this. So there is already a problem to that. So the type 2 diabetes is a metabolic disorder characterized by insulin resistance, and there's low secretion of insulin. So this one is caused by lifestyle, unhealthy eating of diet. The type 2 diabetes is the most type of diabetes because at any point in time someone can develop type 2 diabetes. So there is the gestational diabetes. Gestational diabetes is the diabetes that comes up during pregnancy, and if care is not taken at that period of time, there is a possibility that the person involved will be prone to diabetes in future. So it's also a concern that needs to be taken care of during pregnancy. And also we have other types of diabetes that can result from any other causes. So I would like us to look at the prevalence of diabetes. So the prevalence here is talking about the disease distribution, how this disease is distributed to different states, country, understand, and look at how it is affecting us, what is causing this, and So I would like to read from a paper. According to IDF is an international disease federation. They stated that 537 million people have diabetes in the world, and that among these 537, 24 million people is in the African region, and that by 2045 it will be around 55 million. Let's come to Nigeria. Let's see how it is affecting us. This is a report for the worldwide. How is it affecting the Nigerians today? The total adult population in Nigeria, let's look at it. According to the IDF 2021, they stated that 96,812,400 adult population we have in Nigeria, and among this adult population, 3,623,500 of these adults are already affected with diabetes, giving it a percentage of 37% prevalence in Nigeria. This is according to IDF 2021. I want us to look at a work. This is a work done to check the prevalence and the risk factor of diabetes mellitus in Nigeria. It is a systematic review work and a meta-analysis work that was carried out by Uloko E. Andrew et al. Iloko E. Andrew and others in the year 2018. Yes, they carried out this systematic and meta-analysis review. Systematic review is a very good research because it looks at so many works, different works done in different areas, areas in Nigeria. So these people now brought it together, research on different works, and the work they research on is an evidence-based work. Evidence-based work, they are pre-reviewed works. So the research on 23 studies that studied on diabetes, prevalence and the risk factor of diabetes in Nigeria. So after studying these 23 works online with a peer-reviewed online, research, so they put them into together to conclude, look at what is causing this, look at the rate at this disease is going. So what is their result? What is their conclusion? What is the outcome of their result? They found out that in Nigeria there is a poor prevalence of diabetes mellitus in the 6th geometrical zone of Nigeria to be 3.0%, meaning that it is telling us that 3 in every 100 person in Nigeria have DM. 3 in 100. So you see how important this is to study. So, and again, that South had the highest number of these people among all the geopolitical zones studied. So also they looked at the risk factors that caused this. They found out in their study that family history, urban dwelling, unhealthy diet habits, cigarette smoking, old age, physical inactivity, and obesity are the main risk factors that caused this disease. So among these risk factors mentioned, unhealthy diet habits had the highest percentage, meaning that unhealthy diet habits, causes diabetes more than other risk factors. So you see why your diet is very, very, very important in this. So I want to ask us, is diabetes a disease of public health importance? Though I've mentioned it others why. So what reason? I've given some of the reason. Okay, let me also rate that yes, this is due to rapid increasing prevalence worldwide, significant complication that can lead to premature death and disabilities, and the substantial financial burden it places on healthcare. These people that have diabetes always find themselves in a financial burden because of what? The everyday, taking care of themselves, the healthcare payments and all those things are very, 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 very telling on them, on their finance. So it is of importance we look at this disease. Then again, the complication over time, it damages the blood vessels. The blood vessels in the heart, in the kidney, in the eye, in the nerves. That is why we say some of the complications of diabetes, if the blood vessels in the heart is damaged, it causes BP, high BP. Then if it is in the eye, it causes what we call retinopathy. If it is in the kidney, it damages the kidney, and we'll call it nephropathy, diabetic nephropathy. So if it is in the nerves, it affects the nerves. It is called diabetic uropathy. So these are some of the complications. And foot ulcer, before in it, a person's leg will be cut off because of these complications. So because of the complications, the burden, the financial burden it places, and the mortality rate of this disease, it has been classified as a public health disease concern. And it was stated by the Center of Disease Control and Prevention on the year 1994. It was recognized as a disease of public health importance. So this is the aspect that you need to care for yourself. Remember what I said, it doesn't look at age, it doesn't look at sex, whether you're a male or a female, doesn't take all those. But when you are not in control of your diet, it leads you to this disease, diabetes. So what can we do today to eradicate this disease? Is by helping ourselves. Prevention is the first thing. I wrote on prevention on my Facebook page, prevention and curative medicine on my page, and I stated that prevention is very, very important. So what am I trying to say? Prevention, when we start today to prevent it, whether a child, an adult, whoever, whatever level you are, you start now to control and plan your diet very well so that it doesn't lead to that. Let's look at a way of reducing this mortality rate. Let's look at a way of reducing this disease. So diet management is very, very important, knowing that unhealthy dietary eating is the most cause of diabetes. So that is for prevention. But for people that already have seen themselves, with this, it is not a problem. It is not an everlasting death like No, it is just a disease, something that came up, sometimes unknowingly. So something that gets, so most people don't know that they have this disease. That is why screening and checking up yourself is very important. Check your blood sugar level today. But wait, before I continue, please, if you like this video, you have to go to my channel and like and what, subscribe. Please like and subscribe now so that you get informations on every day-to-day diet and related health. Okay, so I was saying that when the disease has come up, it is something that you can take care of, you can manage perfectly and live as long as you want. Though the life expectancy of this disease in Nigeria is averagely 8 years. So that is also why the disease is important to study and to know how you care for yourself. Life expectancy of this disease, because of the type of complication and the death, the mortality rates, it is 8 years. Average 8 years. That's what it shortens a life of a person to 8 years stay in this world. So look at it. So you have to be concerned of this. So your dietitians, that is where dietitians comes in. Your dietitians is always there to help you out. If disease has already come in or you want to prevent it, please consult a registered dietitian to help you. Consult a registered dietitian today to guide you through. So many have lost their life because of this. So what am I trying to say? There are steps that dietitians take in management of this disease. Remember I said that carbohydrate, protein and fat is a consign in this disease management aspect. So what am I trying to say? It is a concern. You must consult your dietitian to have your food checked and everything. So look at how this are being done. I'll just give you some of the steps we take in our management of diabetes mellitus. First, we'll determine the patient's carbohydrate needs. Then second, we assess the patient's medical regimen. Remember I told you that the type of insulin the person is taking is a consign. The type of drugs, maybe some of the drugs that helps in insulin secretion is important. So we study this type of drugs because they have the different times duration they stay in the body system. So according to that, the carb content you take is calculated according to these drugs. According to the type of drugs you take, we calculate the types of carbohydrate you need and the quantity you need. It works very perfectly. So also, after checking the medication regimen, we choose a carbohydrate with low or moderate glycemic index for you, and also we consider the glycemic load of carbohydrates. Then we calculate the daily carbohydrate intake and place you rightly that will match with the type of drugs you are taking and what your body requires at the moment. So also we monitor and adjust if required. So you see the steps, they are very, very important. You don't need to fight carbs at this point in time, but eat the right carbs. Don't fight carbs, eat the right carbs at this time and the right quantity. Consulting your dietitian, some people feel that before they will consult a dietitian, they have to, make up with their finance and all those things. You can start now, just start, pick the courage. All those things have been mentioned, these steps has been mentioned for just to encourage you, because to encourage you to meet a dietitian. Consult a dietitian today. Person will start management immediately. Managing you, placing you on the right, diet that will help you regain yourself and stay as long as you want to live. When you adhere to what the dietary regimen and prescribe diet. So what am I trying to say here? Management of diabetes is very, very important. That we must tell you that is a self-determination, and you must learn how to manage yourself. You must learn how to manage yourself. This is what the health practitioners, struggle to let people know, that they need their self-management of diabetes. You must know that you must constantly monitor your sugar level every day. Then also your diet, know the type of diet and the type of carbohydrate you need to take. When you know that, okay, there will be a video coming up soon in the next 48 hours, it will be uploaded in my page, Justina and Kechi. Just search for Justina and Kechi, then you will see the video. It's coming up. I'll teach you the different glycemic index of different food, and also the glycemic load, then how you can calculate your carbohydrate. But remember, you must still consult a dietitian. But at this aspect, because it is the fact that you must learn how to manage yourself wherever you are, this is why I am bringing this to you, so that you will know that self-management of diabetes is important. So do well to subscribe to my page, Justina and Kechi YouTube page, Justina Nkechi, for your current and specific and unique information. So see you next time. Bye.